Hi, I'm Chris Yeitter from the Audit and Compliance team within the Business Services Group. I'm here today with Fernando Silva to provide an overview of the services offered by the Audit and Compliance team. I want to tell you about the strides we are making to help CMMI operate as efficiently and effectively as possible. We all know the phrase better care, smarter spending, healthier people is the foundation of the work we do here at CMMI. We have an obligation to protect these models for the people we serve, the public. As we saw with Pioneer ACO, increased success equals increased publicity, which equals increased likelihood for audit. Our organization has evolved and matured over time, and we need our business processes to reflect that. This all ties into Patrick Conway's center-wide goal of operational excellence, and the following are the steps being taken by the Audit and Compliance team to achieve it. At this point, I'll turn it over to Fernando to discuss internal controls and other basic facets of Audit 101.
Thanks, Chris. Hi, I'm Fernando Silva, and I'm from the Audit and Compliance team within the Business Service Group. Today, we'll discuss internal controls, CMMI cycle memo, uniform administrative requirements, cost principles, and audit requirements for federal awards, also known as the Super Circular or Omni Circular. We'll also cover preparing for an audit engagement, guidelines for interacting with auditors, records management, protective health information or PHI, and personal identifiable information or PII. We'll start today's lesson by asking a simple question: what is internal controls? When you came to work today, did you lock the doors to your house? If you did, that's your own internal control to safeguard the assets you own. Do you keep the PIN number for your ATM card in a safe place? I'm hoping you keep it away from the card itself and not in your back pocket. If you do keep it away from the card, that's an internal control the bank recommends to protect your funds from being stolen. Each year, CMMI has a A123 audit performed by an audit firm to assess CMMI's effectiveness of internal controls over financial reporting. This process begins with CMMI documenting and evaluating our entity-level controls through a cycle memo, which is a narrative of our life cycle and operations. Documenting processes accurately is one of the most important steps in the assessment process, as it provides a foundation for the A123 assessment. In other words, once we document a process or control in the cycle memo, CMMI will be held liable to this standard in the audit. CMMI currently has 38 financial controls and 29 programmatic controls. So who is required to have an A133 audit? Any non-federal entity that expends $750,000 or more in federal award dollars during a fiscal year is required to have an A133 audit. That's who. So I know you're asking yourself, how does this apply to my work at CMMI? Well, the A133 audits so far have applied to CMMI's grant and cooperative agreements over the $750,000 threshold. Here's a quick overview of the A133 audit resolution process. CMS Audit Management Division, or AMD, received the audit report from the Office of Inspector General, or OIG. AMD assigns a home region, and home region accepts responsibility for the audit resolution. CMMI clears the audit and completes the OIG Clearance Document, or OCD, within the first 4 months. For the record, the OCD referred to in this presentation is not to be confused with obsessive-compulsive disorder. CMMI sends the completed OCD to AMD with a cleared or closed status. Cleared audit means the OCD has been accepted by OIG. However, not all action has been completed by the auditee. Closed audit means all follow-up actions for all audit findings and recommendations have occurred. Now let's go back to Chris as he explains audit preparation and management.
Thanks, Fernando. In this portion of the training, we'll cover audit preparation and records management. We've created a document concentrated on preparation to prevent this from happening when an audit comes across your desk. Key to avoiding such a reaction is to keep calm and be proactive. This guide targets some focus areas that may warrant additional attention. Once again, it is imperative to emphasize the benefit of being proactive rather than reactive, so as to avoid the dilemma of competing priorities, such as submission deadlines for normal business operations and submission deadlines for the audit. All this will lead to better audit results. Right now, you may be saying to yourself, so here are our suggestions. Start with the performance of risk assessment, reconciliation of calculations to verify data completeness, and records management. Now on to slide 14. Most likely you will not be doing this when news of an audit comes around. But please keep in mind that CMMI's relationship with auditors should be one of cooperation and collaboration. View this relationship from a positive angle. After all, auditors offer constructive criticism. This may be hard to believe, but they are actually here to help. It's important to remember that all CMMI employees are responsible for records management. Here on slide 17, we will discuss the importance of records management. Benefits of records management include reducing operating costs, improving efficiency, minimizing litigation risks, and many more. Several memos have been released explaining the steps we are taking to implement a records management program here at CMMI. Please reference the links for more information. Don't worry, they're not as extensive as the one in the picture. Here we have on slide 19 a fact sheet created by the Business Services Group. We created a document to address some frequently asked questions surrounding email records management, protected health information, and personally identifiable information. The responsibility to identify and manage an email record belongs to its author, if internal, or the chief recipient if received from an outside organization. Email related to CMS functions, policies, decisions, procedures, operations, or other activities of the government qualify as records. PHI can include diagnoses, medications, or dates of treatment. PII is any data that can potentially identify a specific individual, such as date of birth or social security number. That concludes our Audit 101 training. Thank you for your time.
Please contact Chris Yeitter, Andrew Keenan, or myself with any questions, comments, or concerns.